Last week we talked about when you should use ice after an injury. You can use ice immediately, but you should never use heat immediately. Heat increases blood flow to an area, which brings nutrients to the area and does help for muscle repair. However, you never want to use heat if an area is inflamed. But you can use heat for tight muscles or if you have a chronic condition that's been there for more than 3 months. When an injury is no longer inflamed or warm, then it's okay to use the heat so that you can stretch your muscles. But I recommend you use moist heat as opposed to dry heat. But there are times when you should never use heat. If you have a cancer or malignancy, impaired sensation, say you're diabetic or you have peripheral vascular disease and you don't feel things as well, then you don't want to use heat because you don't know when it gets too hot. You don't want to use heat if you have impaired blood flow, multiple sclerosis, pregnancy, or have a blood clot. These are times when you never want to use heat. Now, if someone looks at your back and they say, your back looks like a checkerboard, that means that you've been leaving the heating pad on too long and that you have gotten superficial burns. You should never leave the heating pad on for more than 15 minutes at a time. Otherwise, you are going to get some superficial burns. Now, at 36 hours after an injury, we are not sure whether you should use heat or ice. Well, if you try the heat and it feels good, then it's fine. But within an hour or a half hour, your muscles get stiff again, it probably means that they're still inflamed. So don't use heat. I hope this video has been helpful to you. And if it has, please share it with a friend. And I'll be back again next week with another tip for a pain-free Friday.